Welcome to Delivering Miracles, a podcast to teach women like you tips and strategies on how you can have a safer pregnancy so you can bring home a healthy baby. I'm your host and your high-risk pregnancy expert, Parijat Deshpande. I can't wait to chat with you. Earlier this year, I had a client come to me because of a second trimester loss that she'd experienced. Extremely traumatic, right? So scary, so difficult. I mean, difficult doesn't even begin to describe it. There are no words for how hard that experience was for her. And when she came to me, she knew she needed help. She knew she pretty much wanted the help. She was a little nervous about doing the work. And her doctor highly suggested that she get some support working through the trauma of her experience. But she was really resisting the work. She was drinking all the time. She was exercising constantly, which, hey, exercise is great, but to an extent, you can overdo it. She was working all the time. She was in the office constantly. And her go-to phrase was, "I'm fine. I'm sad, but I'm fine." Because she, in her mind, identified as being a really strong woman, which she is. She was and she is. But to her, strong meant, I've got it all together. I've got it all kept in place. I'm not going to let anything fall. I'm not going to let any pieces fall out of my arms. And in these ways, she really resisted doing the work. Even when we started working together, it was really hard for her to let go of some of these habits that she'd created as a way of protecting herself from feeling. Because when we think of something like trauma, it's scary, it's big, it's painful, it's hard, it's too much. It can feel super overwhelming. And so we resist it. We resist looking at it. We find all these other things that we could do instead to fill our time, to fill our minds, to keep our hands busy. We look away from it because it's too painful. And it feels like looking at the sun directly without sunglasses on or without the special glasses that you have for the eclipses, right? That are meant to protect your eyes. So when you look at the sun directly, it hurts, and it hurts so bad and it hurts so quickly that it's kind of your body's way of saying, look away or you're going to burn your eyeballs, right? And the same thing happens with trauma. We think that by processing it, by looking at it, by dealing with it, it's going to be like looking directly at the sun. And yeah, it is, if you don't have the right tools to do it, right? We can look at the sun all day long if we've got the right eclipse special sunglasses. You need the right tools to be able to do it properly. And that's what I want to talk to you about today, is how to recover from trauma. Now, this is a huge topic. We're going to come back to this many, many, many times. But today I want to talk about one special aspect of the healing process, which is leaning into trauma. The easiest, simplest, and gentlest way to heal from pregnancy or birth trauma is to lean into it. So before we go any further, though, and I talk about what that exactly means, because I know it's a really nebulous concept. What do you mean lean into trauma? I don't know what that means. Totally fine. But before we go there, I want to talk to you about what is trauma, because I think it's the confusion starts there. And not just the confusion, but the resistance starts there. It can start with the idea that, well, I didn't experience a trauma. That wasn't traumatic. And maybe that's you telling yourself that. Maybe it's you trying to minimize what you're going through. Maybe it's coming from a place of comparison that, oh, well, what I went through wasn't nearly as bad as what that woman over there went through. So my experience can't be traumatic. We all do it. So that's why I want to clear this up for a second before we move forward, which is, what is trauma? And how do you know if you've experienced it? There was a time in my past life before all of this happened, before we started having a family, where I used to teach at a university. Loved that job. And I would teach all types of psychology classes to upper division undergraduate students. One of my favorite classes to teach was clinical psychology, sometimes called abnormal psychology. And the very first time that I taught that class, we did a whole segment on trauma. And a student raised their hand and said, well, what is trauma? Like, what is the definition of trauma? How do you know what that line is where something is traumatic and something is not? It's just scary. And the answer that I gave that student in that class is the one that I give now going forward everywhere, because I think it captures exactly what you're looking for with that question. And the answer is trauma is in the eye of the beholder. That means trauma is whatever you think and you experience as traumatic. That may not be traumatic to me. It may not be traumatic to your neighbor or your sister or your children, but it is traumatic for you. And I think that's a really important distinction and a really important definition to keep in mind, because trauma is tricky because nobody else has experienced it, right? If you're going through fertility treatment, you're going through a high-risk pregnancy, you're having some experience of birth trauma, no one else was there with you. It's not like war or some kind of community disaster or natural disaster where there's a community of people, group of people who are going through it with you, where you can kind of look to the sides and go, okay, I'm not crazy. This is really bad. And I think that's what's really tricky about pregnancy and birth trauma, is that there is nobody else right there. There's tons of people there. You've got a medical team. You've got your partner. Maybe you've got a doula, a midwife. You've got nurses. You've got all kinds of people. You're not actually alone, but you are alone in it. And that can be really tricky when you're trying to process what happened and you feel like maybe you're making a big deal out of this. Maybe it wasn't that bad. Everybody else is telling me it wasn't that bad. Or you feel like you can't rely on your memory, which happens a lot when you've experienced a trauma. It impairs your memory. So trauma is in the eye of the beholder. And I think that's something that is so important to remember. And I want you to keep reminding yourself of that. If it was traumatic to you, if it felt traumatic to you, you experienced a trauma. That's all it is. You don't need it to be validated by anyone. And the thing is, this is an example that I used to give in that lecture when I'd give it, is it doesn't have to meet a certain threshold of scariness or danger for it to be traumatic. It can be something very simple, like imagine going on a walk in your neighborhood. It's you and another person, and you're walking down the sidewalk and you hear a dog barking from behind a fence. You both might jump. Your heart might stop for a second. You might look around to kind of find that dog. Where was it? Make sure that you're safe and all of that. You might just be scared. And then 2 seconds later, you're fine and you laugh about it. You go, oh my gosh, that was so terrifying. Can't imagine what a big dog that was. And your friend that you're with, that might have been a traumatic experience for her. That's enough. Trauma doesn't have to be these big, huge events. It can be something as simple as a sound like that. It can be as simple as a conversation you have with your doctor in the exam room. It can be as simple as a particular treatment or intervention that needs to happen for you or your baby where maybe you don't feel like you gave consent. So many women talk about having an episiotomy as their experience of trauma. And I'm talking about this for so long because there's too much emphasis on qualifying and quantifying trauma when that has nothing to do with the actual experience and the healing of it. Trauma is whatever you felt to be traumatic. It does not have to meet a certain criteria. It doesn't have to be a certain level of difficulty, certain level of fear, certain type. It doesn't matter. If you felt it was traumatic, it was a trauma. Trauma is in the eye of the beholder. Okay? So given that, I think there are a lot more women who've experienced pregnancy and birth trauma than we actually admit to and acknowledge. It happens so frequently, but because we don't talk about it, nobody really knows. And they kind of leave the hospital with their new baby going, everything should be fine, but I don't feel great. I don't know why. Because we don't talk about this stuff. We don't talk about this side of it. So that's why I'm hitting it home so hard. Trauma's in the eye of the beholder. If you felt it was a traumatic experience, no matter how big or small, no matter how important or minuscule that moment even felt, If you felt it was traumatic, it was a trauma. And it needs to be healed, needs to be worked through. It needs to be released because it will not go away on its own. It won't. We like to believe that if I just look away, if I give it enough time, as I see my baby getting bigger, stronger, healthier, it'll be better. And yeah, it does get better. It does get better. I can tell you that from personal experience. That does get better, but the trauma never goes away. The trauma remains unresolved. And as you've heard, if you've listened to Delivering Miracles over the last several episodes, you know that my approach is a very body-centered approach. It's a very somatic mind-body approach on releasing that trauma because it kind of sits in two different places. It sits in your head. You've got all the thoughts, and then it sits in your body and it has all the body symptoms. And we usually address the cognitive, the thought side of trauma, and we rarely focus on the body. And the body is where it creates it. The body is kind of like the roots of a tree, right? You can cut down all the branches. You can cut down even the trunk of the tree. But if the roots are there, the tree's still there. Same thing with trauma. Same thing with anxiety. Same thing with stress. Same thing with depression, all of that, right? So then what are the signs of unresolved trauma? Like, what are the signs that you've still got the roots in there? Now, I want to be super careful. This is not a self-diagnostic tool. I don't want you to sit there and go, oh my God, I have PTSD. This is not that. Okay. PTSD is a clinical diagnosis that can only be made by a licensed mental health professional. You cannot diagnose yourself with PTSD, even though I know many of you are going to do it anyway. I get it. I get it. Totally get it. It reminds me of when I first started studying clinical psychology. I was actually an undergrad, so I wasn't even in clinical psychology yet. And my professor at the time was telling us, don't develop medical student syndrome. You're going to go through this class. You're going to think you have every mental health disorder in the world. And don't do that because you don't. And I was like, okay, I'm not going to do that. And then we got through mood disorders. And I was like, oh my God, I have like 3 of them. We got into psychotic disorders. I was like, oh my God, do I have a psychotic disorder too? Anxiety disorders. Like, I get it. All this to say, I get it. I've done it myself, but don't do it now. Okay. You don't have PTSD unless a clinically trained, licensed mental health professional diagnoses you with it. Okay. Now we could do a whole other episode on this because there is also nuances in that if they're not familiar with pregnancy trauma, birth trauma, prematurity, NICU, many women and men are actually misdiagnosed or undiagnosed with it. That's a whole other thing. So reining it back in, I'm going to talk a little bit about common signs of unresolved trauma just to get you thinking about whether this is going on for you. But please don't diagnose yourself. If you need help with that, reach out. I'm happy to send you some referrals for mental health providers that I know and trust will be able to give you the right support if you do believe you have PTSD and who are familiar with the nuances of pregnancy and birth trauma. Okay. So here are a few of the common signs that you have those roots still there. You know, you've got this unresolved trauma that's lingering. And I'll stop here for a second also to say this can mean that even if you delivered a year ago, 5 years ago, 10 years ago, 20 years ago, this can still apply to you. We're not just talking about the first 6 weeks or first year after your baby's born. This can last for decades. Okay. So if you're listening, if you're listening, you're thinking about your mom or you're thinking about your aunt or somebody else that has delivered many years ago, this might still apply to them. Okay. You might notice that your anxiety is higher or you've developed panic attacks. You never had panic before. You've never been anxious before. And you've just noticed you're just more anxious or more on high alert or hypervigilant, which it's a clinical term, which really just means you're on high alert all the time. You're kind of watching out for everything, just waiting for the other shoe to drop or waiting for something to go wrong. Here's the big one. You feel shame. You feel like you are not worthy of, say, joy, happiness, good things, that you would rather wear tattered clothing with holes and spit up stains on them, but you're going to buy everybody else the nice clothes, but you won't buy them for yourself. Not because you're saving money, but there's this underlying feeling of, I don't deserve this. Okay. If you've developed depression or depressive symptoms, if you feel low, if you feel sad, if you feel disconnected, if you feel numb, those are some signs. If you're avoiding places or people that remind you of that traumatic event, if you For example, I actually spoke with a woman not too long ago who would not go to her 6-week postpartum check. Not because there was anything wrong with her doctor. Her doctor actually did not deliver the baby. She wasn't actually there. So her colleague delivered the baby, and there was an experience of birth trauma there. And she just couldn't go because she just didn't want to experience that again. So there's that. If you have flashbacks, nightmares, or body memories regarding the traumatic event. Body memories is huge. That's a huge, huge, huge piece of the work that I do with my private clients. Because it's those roots. It's those roots that sit down. They really latch on in your body. And even if your head's in a good place, your body can and does remember the trauma. And so being touched a certain way or having a certain smell around or certain type of food. I'll tell you, I couldn't eat. We have a restaurant here called Sweet Tomatoes. I think it's called Soup Plantation in other places. I used to love that place. Every year for my birthday, that's where I would go for lunch. I loved it. Oh my gosh, it's salad. It's like a salad bar and soups and breads that they make on site. It's really delicious. And I had it. Now I can't remember exactly when it was, but it was towards the end of my hospital stay. And so it had been a little over a week. And that entire time was massively traumatic. Never knowing when my son was going to be born, knowing that if he was born anytime before 24 weeks, he's probably not going to survive. And after 24 weeks, the chance of him surviving is still also really, really tiny. Terrifying. So traumatic. To this day, I can't eat there. Haven't been able to do it yet. Before it was, I would drive by and I'd see the sign of the restaurant and I would have a very visceral reaction to it of just not wanting to gag necessarily, but it made me feel very sick. Now I can drive by it and it's fine. I've actually even stepped into it once. We almost had to go there once because we were trying to go somewhere else and the wait was too long and it was right next door. But still, to this day, if I have the choice, I would not go there again. And that's a sign for me that there's a little bit of unresolved trauma still there. It goes on. We'll talk about that in a second. Those are the types of body memories I'm talking about. Those are the ones that I work a lot with my clients on. It's really powerful stuff that is really incredible in terms of releasing that trauma. Some people develop some kind of addictive behaviors. The client that we started this episode with, I wouldn't say she had a drinking problem in terms of alcohol addiction, but there were some addictive type behaviors where I have to work out today. And I have to work out for 2 hours every day. I have to stay at work and I have to just keep going. I have to keep drinking. There was this compulsive behavior around it because you're trying to stay numb, right? You're trying to shut it off. A lot of people have issues with sleeping, trouble going to sleep, trouble going back to sleep when they wake up in the middle of the night. A huge piece of this that comes up for a lot of women that I talk to is feeling dissociated from their bodies. They feel cut off from their bodies. They feel like it's not their body. Some of them actually feel numb to touch. If they put their hand on, say, their arm or their leg or something, they don't feel it as strongly as they used to, right? It's a very physical experience when you go through a birth or a pregnancy trauma. On the more severe side, definitely, if you have suicidal thoughts or plans, that is certainly a sign. And if you are listening and you have thoughts of harming yourself, please, please, please call 911 or call the suicide hotline at 800-273-TALK. If you know somebody who has suicidal thoughts or plans, please get them the help that they need as quickly as possible. They deserve it. You deserve it. Another one that comes up really frequently is uncontrollable anger, just feeling really angry all the time. Having a short leash, almost a short fuse, snapping at people, picking fights. That's huge. It's huge. It happens all the time. These are just a few to think about, just a few to get your thoughts going about, hey, is this trauma? Is this what's going on? Is this something that I need to look at? Okay, because if you're listening to this episode, there's somewhere in you that knows this is something that needs attention. When we come back, we're going to talk about what is this concept of leaning into trauma? What is it? How do you do it? And why is it important? We'll be back in just a second. Hey, have you checked out my brand new book, Pregnancy Brain, yet? It's all about the mind-body approach to stress management during a high-risk pregnancy specifically. It has stories from my very high-risk pregnancy, tons of client stories, and so much research on the impact of stress on pregnancy and pregnancy complications and how you can have a healthy pregnancy. I would love for you to check it out at pregnancybrainbook.com. That's pregnancybrainbook.com. Okay, welcome back. So we are talking about leaning into trauma, birth trauma, pregnancy trauma. It happens so often to women who are experiencing a high-risk pregnancy, have delivered preterm, or really a lot of women, even if they've had a healthy pregnancy and a healthy delivery at term, can still experience birth trauma. So we're talking about how to release that trauma. It's a huge topic. And today we're talking about the one aspect of it, which is leaning into trauma. Now, what does that mean, leaning into trauma? There's 4 pieces of that. It's kind of 4 pieces to it. One is acknowledging that you have experienced a trauma, which is why we spent so much time earlier in the episode talking about what is a trauma and how does it show up when it's unresolved. Because it's really easy to minimize. It's really easy to compare and go, well, my child was born at 32 weeks. That's not as bad as that person over there whose kid was born at 26. Yeah, it's not as early. That doesn't mean that it wasn't as traumatic as hers, or it doesn't matter. The comparison is different, right? Because if you remember, trauma is in the eye of the beholder. So it doesn't matter what the other person went through. If it felt traumatic to you, you experienced a trauma. There's no comparison here. There should be no shoulds, no minimizing of it. You've got to acknowledge that you have experienced a trauma. And I find that this is the hardest part about all of this. There has to be a moment where you sit down, you're able to breathe through it, and you go, I experienced a trauma. And being able to say that. You don't have to tell anybody. You can do this completely privately, but you've got to be able to say that to yourself. You've got to be able to acknowledge it. Part 2 is then acknowledging that you have signs of unresolved trauma without judgment, without shame. That's also really hard to do. If you can remember my client that I started this episode with, she had this very strong identity of being a strong woman, and she is a very strong woman, but strong people can experience trauma too. Strong people can have unresolved trauma also. If you don't have the tools to know what to do with it, how are you ever going to be able to? We can't do anything unless we have the tools. Nothing in life. We have to learn it all, right? And if you've never been taught, if you don't know, if you don't have the right support around you, there's no way you're going to know. That doesn't say anything about you. Really, it says a lot more about our society and how we don't arm women and mothers on how to work through this, let alone how we can reduce the risk of pregnancy and birth trauma anyway, but that's a whole other conversation, right? This has nothing to do with you, or it doesn't say anything about you, but you've got to be able to sit there and breathe through it and acknowledge, I've been through trauma and it's still unresolved. Whether that trauma experience was a year ago, 5 years ago, 15 years ago, it doesn't matter. Or 5 minutes ago, it doesn't matter. You've got to be able to do that. Then part 3 is about giving yourself permission to heal. You see how we've gone through 3 out of the 4 so far, and I haven't given you a single tool yet, right? Because no tools are going to actually work. No deep breathing, no meditation, no therapy is even going to work until you do these steps. You've got to get out of your own way. And this is a really big one. Giving yourself permission to heal. All of us, we tend to punish ourselves when we can't find anyone or anything to blame for what happened to us, which happens all the time through infertility, through high-risk pregnancy, when you deliver preterm, if you're in the NICU, who is there to blame but yourself? And so we punish ourselves. There's an entire chapter in Pregnancy Brain about this very topic because it happens that often. We think we don't deserve to heal, so we don't take the steps that we need, that we know that we should take. We know that we need it, we deserve it. We know we need it and we know we should, but we don't feel like we deserve it. And so we don't do it. You know you need to go see a therapist. You know you need to work with a professional. You know you need to eat better. You know you need to exercise more. You know you need to be around friends more. You know you need to ask for help more. Whatever that is, you know it. You know it right now. Sitting here listening to this, you know exactly what you need to do. But you have to believe, not think, you have to believe you're worthy of receiving that support. You have to believe that you are worthy of healing and feeling better. You have to feel worthy of being able to feel joy and peace again in this new chapter of your life post-trauma. There's not a single tool that you can learn anywhere that is going to be effective until you give yourself permission to heal and really believe that you deserve it. So you've got to acknowledge that you've experienced a trauma without minimizing, without comparing. You've got to acknowledge that you have signs of unresolved trauma without shame and judgment. And then you've got to give yourself permission to heal. And then part 4 is you've got to integrate your trauma into your story, into your journey, and into your identity. Now, I want to be clear. I'm not saying you are a traumatized person and that's now your new label. That's not what I mean. What I mean is you've got to include it as part of your story so that you can recount that story without it being such an emotional charge or without wanting to hide from that part of your story. I did that, especially when he was in the NICU. It was so hard for me to accept that our story is going to be that I had a son who was born at 24 weeks and 5 days, and that my body could not keep him in any longer than that. I hated it. I was angry. I was so angry. I didn't want to talk about it. And I thought about once he's out and when we start meeting people and hanging out, like I'm not going to have a story to tell and I'm not going to be able to talk with other women when they talk about their birth stories or what their experience was like in the first days of parenting. They all went home and were exhausted, and I was traveling to the hospital every day for 109 days. That's not the same. I was mad. I was angry. I was resentful. And it's taken a lot of work. It's taken leaning into the trauma. It's taken giving myself permission to heal, to be able to now talk about this and share my story with you through Pregnancy Brain, through this podcast, in a way where it doesn't bring up tears all the time. And I mean, that's not true. There are times when it does bring up tears still, but they're not so overwhelming that I can't continue. They're not so all-consuming that when I think about certain aspects of our journey, it drops me down a hole that I can't get out of for a day or two. And it doesn't change my identity of being a strong person, of being a protector, or whatever it is that I thought of myself. And like the client before who felt like she's a very strong person, you can be all those things and also have gone through what you've gone through. That's the point of this, is to be able to integrate that together, to say, I am still lovable, I am still strong, I am still confident, I am still productive, I am still whatever, and this is what I've been through. These are the 4 steps that I mean when I say leaning into trauma. And again, look, I'm not giving you any of these tools, right? The tools come later. The tools come later. You've got to get out of your own way, because the easiest, simplest, and gentlest way to heal from pregnancy or birth trauma is to lean into it. Leaning into it is not rushing through trauma work. It's not forcing yourself to do it before you're ready. I actually had a client recently, very recently, whose program we actually extended because she was not ready to do the work. Now, I take my signals from her body, not her mind. You've heard me say this before, that we can talk ourselves in and out of anything, but our body never lies. Our body was telling me we weren't ready to do the work, and so we extended it. I will not force my clients to do the work before they're ready. I do not want you to do the work before you're ready. I had a friend who I actually discouraged from going to therapy for a little while because I knew she wasn't ready. She knew she needed to go, and she did eventually go. But at the time, things were so raw that it would have actually hurt more to go at that point. It's also not this one and done type of work. Leaning into trauma doesn't mean when you do it once, it's over and the trauma is going to be gone. It's like cleaning a house. If you do it constantly, if you do it frequently enough, there's less to do and there's less that piles up over time. This is not something you clean the house once and then it's going to be clean forever. I think we wish that for both these things, but it's not how it works, right? And leaning into trauma is not supposed to be painful. It is not supposed to be painful, and that's why I stand behind it so strongly. You have been through enough pain in your life. You do not deserve more pain as you're healing. I didn't want it. I'm pretty sure you didn't want it either. So it should not be painful. If you find it painful, if you're going to therapy, if you're working with somebody, and you're finding it to be so painful, like you're ripping open that wound and setting it on fire every single time, stop. Please stop. And go find somebody else. It is not worth it. You've been through enough pain. Leaning into trauma should not be painful. Leaning into trauma is the easiest, simplest, and gentlest way to heal from pregnancy or birth trauma. It really is. I've experienced it personally. I guide so many women through it professionally now. It works. It doesn't hurt nearly as much as you think it's going to. And it has really, really long-term positive effects for your health, which ultimately trickles down into your ability to be a really good wife and mother and friend and sister, neighbor, employee, right? You need that. You deserve it. And it trickles down into everybody. So what is the point of all this though, right? Why do we do this? Well, I thought about this topic. It came up because I talked to a lot of women who've gone through this. I'm so honored to hear from women so frequently who share their stories of what they've been through. And it's a lot. There's so many of us that go through such hardships on our family building journey. And too many of them tell me that they think they're changed forever after this experience with pregnancy or birth trauma. And yes, you are different. You will be different. Like anything in life, right? Graduating college or getting married or buying a house or buying a dog. When you have these big life moments, they do change you, but they don't change the core of you. And that's the misconception that a lot of women who reach out to me have, is they assume that they can never be as happy or as relaxed or as confident or as comfortable or whatever it is that they thought they were before. They don't think they can ever be that way again. And that's just not true. It's just not true. And part of that, I think, is a fear of, if I look at it, if I do the trauma work, it's going to hurt so much that I just don't want to do it, which again goes back to that analogy of looking at the sun. You can do it if you have the right tools that'll help you do it gently. But really, the only way to release that trauma is you've got to look at it. You can't turn away from it because it's not going to go anywhere. And that will change you. That will change you and keep you in this place where you're not safe. You don't feel safe. You don't feel comfortable. You don't feel truly, truly happy. That's when it doesn't change, is when you look away from it. So when you acknowledge what you've been through and you give yourself permission to heal and grow, you can become the best version of yourself that you've ever been. And you deserve that. You absolutely deserve that. I have an entire one-on-one program for this. I also have a guided workshop about this. So if you want to know more about how to do this gently, easily, simply, shoot me an email at info@parijatdeshpande.com. That's going to be in the show notes as well. And we'll send you the link to the Healing from Guilt, Grief, and Trauma postpartum workshop. Check it out. I'll send you the registration details and you'll get to learn about how to do this yourself, because it's totally possible. And it's actually way less work than you think it's going to be. But it starts with leaning into it. You've got to lean into the trauma. It's the easiest, simplest, and gentlest way to heal from pregnancy or birth trauma. Lean into it. Acknowledge what's happened. Acknowledge that it's unresolved trauma sitting in your body. Give yourself permission to heal from it and integrate that into your story. You deserve it. Thank you so much for joining me here today. If you liked today's episode, I would love it if you can head over to iTunes or Apple Podcasts and subscribe and leave a review so that the podcast ranks a little bit higher and a little bit higher, so that more women who are recovering from pregnancy or birth trauma, who are going through a high-risk pregnancy or infertility right now, or who are sitting bedside at the NICU, can find this podcast, can tune in and receive inspiration, tips, and motivation and hope on how to get through the ups and downs of a complicated family building journey. I would also love to stay in touch, so follow me on Twitter, Facebook, Instagram, and Pinterest at Parijat Desh. That's PARIJATDESH. You deserve to heal. You deserve to feel joy again. You've got to believe that, and it will happen if you allow it. That's really all it takes to begin. That's where it starts. As soon as you give yourself that permission, as soon as you lean into the experience you've been through, doors will start flying open and you will feel joy and peace again. Take it one day, one step at a time. You can do this.